Arthur, would you like to introduce Paul, please?
Okay, I'll be delighted to. Well, although in Canada we pride ourselves at being very socially conscious and we look after the underprivileged, but there are cracks in the system and people fall through the cracks. And one organization that looks after this sort of people who have been sort of not looked after is the Canadian Centre for Refugees and Immigrant Healthcare. Dr. Paul Caulford is one of the founding members of this organization, and they have been doing, terrific work in providing help for all these unfortunate people. Dr. Caulford has practiced family medicine in Scarborough for 43 years. He's the past Chief of Family and Community Medicine at the Scarborough Hospital and past Program Director for Family Medicine Residency Training at the University of Toronto, the Scarborough Health Network. Dr. Caulford graduated from the University of Toronto School of Medicine in 1978. Prior to that, he graduated from the same university with an honors bachelor's degree and a Master of Science at Toronto Hospital for Sick Children. In 1999, Dr. Caulford founded what is now the Canadian Centre for Refugee and Immigrant Healthcare, providing free medical, dental, mental health, and social determinants care to refugees, medically uninsured and undocumented migrants and workers, and the homeless in shelters in the Greater Toronto Area. He remains an active physician, medical lead, and executive director at the centre. Now a diverse team of 70 volunteers and staff, physicians, nurses, dentists, nurse practitioners, and others bringing health equity to Scarborough and the GTA. He's our guest today, and he's going to talk to us about what this organization does.
Okay, great. Thank you, everybody, for having us. And the center, I hope I can give you some knowledge and share some new information that catches your thoughts and makes us think a bit more. I also wanted to take a minute to thank you for the generous donation you gave to our center. And it's greatly appreciated, and it's already being put to work specifically for the purchasing of medications for diabetic patients who don't have access to diabetes care, which is a major tragedy in our Scarborough region. Okay, so here we go. I'll just move ahead. That's a picture of our center at 4158 Shepherd Avenue East. It's the house next door. It's the old manse of the Knox Presbyterian Church, actually, and it's perfectly situated for a medical center between a church and a funeral home. So we've got all the bases covered. And the sort of theme today is health poverty and inequity in Scarborough and to a degree the GTA, but I'm really talking about Scarborough here. That's where we were spawned. It's where we came from. And the talk today is going to be sort of a yesterday, today, and tomorrow look at things. We'll wind through a brief history of who we are, of our history and who we are, what we do. I think most importantly, why we do it. I think in this world, a lot of people who even work in an organization don't understand necessarily even what they do, but most people can tell you hopefully why they do it. And I think where to next is a very important chat, because we got to take this thing beyond the founders if it's going to sustain itself. Our vision is pretty simple. We believe that everyone new to Canada must receive the medical care they need, regardless of their status, their circumstances, without judgment and unstintingly beyond even their ability to pay. So we don't charge. And we have certainly found with COVID that nothing has been truer than when we fail to provide health care to everyone in our community, we provide care to no one. We were in our parking lot, I'll just amplify that for a minute, in March 2020, treating patients who were coming in with COVID. And that was March the 5th that we saw, between March the 5th and the 9th, we saw we saw 6 people in their cars with COVID symptoms in the very early days of this pandemic. And we didn't have COVID testing centers. We weren't as advanced then in terms of being able to care for them. The only place we could send them, we thought most people, significant risk of death, was to the Emerge. And when we referred these patients to our emergency with support from Toronto Public Health, they were turned away. 22 years after we started to try to stop that. They were asked for $800 and were sent back. When they didn't have it, they were new Canadians who'd arrived and some of them were in the 3-month waiting period. Some of them were family members and visa folks and didn't have access to OHIP. We call it no-HIP for them, and didn't have access to interim federal health, didn't have $800. And they were sent home without any advice, without any care. And then the hospital started sending us their patients who were uninsured. So we wrote, this was a very important accomplishment for us. We were very, very happy with this. And we wrote to Mr. Ford, Premier Ford, we wrote to Minister Elliott, Minister of Health, and to John Tory, and to Patty Haiju in Ottawa. And we got one of my neighbors, who's an MPP, was an MPP in Kathleen Wynne's government, to make sure they got delivered to their desks, because it was a hectic time. And they did. And to their credit, those people I just mentioned, we got an email from Minister Haiju back. Mr. Ford announced that everyone in Ontario, all undocumented, all uninsured, for the duration of COVID until he says otherwise, which he hasn't yet, I don't think he can, will receive healthcare free of charge if they attend the emergency. And there are some community codes. It's working better. It hasn't worked perfectly, but it's certainly been a major boon. So let's take a trip back in time to May 2000. And if you want to go back further to 1999 in Scarborough, I had just become chief of family medicine at the Amalgamated Hospital. And I was in a meeting and a piece of paper kept being shoved my way. And it was about a young woman named Aisha. And Aisha showed us something. She was 17. She was undocumented. She was from Grenada. She'd been sent for by her father because of the war earlier when she was 12. When Grenada was invaded, it was an unsafe place for young people. And she came and she was sponsored and she was 12. And then the family broke apart, the sponsorship broke apart, and Aisha was cut loose and she decided to stay in Canada and make her way. And did she ever? She put herself through school. She was undocumented. She worked under the table. She did people's hair. She got some student welfare, graduated from high school. And that year that she was going to Centennial College to be a nurse, she was stricken with a sickle cell crisis. And she got very sick, and we sent her to the emergency department, and she was turned away. And they said, doesn't look like an emergency. You can talk to us, so you'll have to pay. And she said, I don't have the money, I can't pay. And my savings are for my nursing education, which I'm going into, and I'm going to be very sick. And they said, well, when you are, we'll take you in. So it's unbelievable. It's still happening today. And when she had the presence of mind to sit in the waiting room, and when she collapsed down onto the floor, they came and got her and brought her in. She spent 4 days in the hospital, and she received a bill for over $4,000. So to become a nurse can look like this. And I just wonder who that's good for. Her, us. So what we learned from Aisha was this. It dawned on us that if it was Aisha's job to put herself into nursing, put herself through school, make her way in Canada, not be insured, that if she and when she got sick, it was our job to help her. And if there was no clinic or system to do that, then frankly, it was our job to build one. And that's what we set out to do. And we investigated, we found there were many thousands of Aishas in our community in Scarborough. In '99, there was no research about it. There was nothing published about uninsured in Canada. As far as the world knew, Canada was this wonderful, beautiful nation that helped everybody get health care. So that was what got us started, and one thing led to another. We did a little research on another fact that was, I think, important why we do what we do. It's an interesting little fact that in 1808, 200 years ago, there were 490,000 people. As best I can tell, maybe 500,000, 510, from the censuses I could find in the Maritimes and Upper and Lower Canada at that time. And that was roughly 200 years ago. Now, 38 million in Canada. What interested me was that it was an increase of 90-fold in our population. And so clearly the immigrant refugee experience has been part of all of our families for these past 200 years. But what interested me too was, what about old world nations? What about England? What about France, Italy, Germany? And you can see the huge difference in their population growth in the same time period. Canada is really a new world nation. It's immigrants, migrants, refugees, and other populations have made a significant difference. And without them, I don't think the pioneers, we would be as successful and prosperous as we are. And right now, Canada is down 400,000 newcomers since the pandemic began. Everybody thinks, oh, we'll get that back. Those are jobs, those are talent, those are people who are coming. And people think we'll get that back. Because Canada's been a number 1 or 2 choice around the world as a destination for newcomers, and including our refugees that we take. But I'm not so sure we're going to get them back. The competition is big now out there. It's hard to know what movement's going to be like or allowed. We don't just throw open our doors and expect that we'll get them. Right now, wages in other countries are rising in Europe and elsewhere for competition for those who wish to be on the move for economic reasons and health reasons and refugee reasons. This is a quick little look at Canadian growth, population growth over the roughly 150 years, I guess, and 160 years. And the red represents migratory increases. And you can see starting around the 1960s that as the Canadian birth rate has become and remained anemic, we're not going to replace our workforce by ourselves in any way, shape, or form. In fact, to the point where 2030, we will be taking over 4 jobs will have to come from offshore if we wish to sustain the 2 cars in our driveway and our prosperity. So it's for them, but it's also for us. And quite frankly, from what we've seen, all of our patients are out working, whether they have a work permit or not. They're working under the table, off the grid, without protections. They're contributing to our prosperity. They are caring about the Canada they came to or their parents brought them to. And I'm not so sure we're caring enough back. Especially, what's the point to allow them to become unhealthy over time, not having access to healthcare, and then not being productive workers? They are filling the gap right now in the 400,000. I'll come to that in a moment. So that just is a quick look of representing the 124 nations from which people in our clinic have been treated these past 22 or 3 years. And that's just a sort of a mock-up of Canada with a flag from every country and a name from every country that we've had patients from. And we're volunteer driven. We are a health, dental, social group of social professionals and peers. They're our peer providers. And I want to talk about one word that you'll see at the end up there, and that's called abundance. What else Aisha taught us was that when there's an authentic problem, You will find, we will find, we did find the people you see on your screen as we go down. They are our volunteers. We've only had a couple of thousand of them. People keep wanting to come and make Canada stronger. They volunteer all the time, doctors, nurses, social workers, nurse practitioners, the general public who take care of our charts and our charting, our technology. We have an electronic medical record. We've always had the belief that if we're going to build a medical clinic because they don't have one, it's going to be the same as the one we or each of us uses. It can't be less. It can't be level C or B. It needs to be exactly as competent as the one that we are treated in. Just a few of our volunteers. Our programs: general primary care and family medicine, drop-in and scheduled. The SWAN Clinic, which is for immigrant and migrant refugees, undocumented, full women's health care, Mount Sinai partnership with specialists who've come forward to say, how do we help? Dental, we have 3 modern dental chairs. The dental clinic cost us $400,000. Every penny was raised through donations. They're operational now with 20 dentists. They're keeping people out of the ER for dental care. These are 20 volunteer dentists. I mean, it's just completely humbling what people are doing. The POP clinic is a children and youth new to Canada clinic. 28 to 30% of the patients in our clinic are children and youth new to Canada who don't have access to healthcare. My opinion is 11% are under 1 year of age, cannot get their vaccinations unless we're there. And in my view, this is a form of, I can get a little bit mouthy. It's a form of almost a national disgrace and child abuse, and I'm shocked that we allow it. I'm shocked that it's still going on, that the politicians haven't changed it. Toronto's Hospital for Sick Children sends us pediatricians and they're training pediatricians, and they run free clinics at our center. Not as often as we'd like, and hobbled quite a bit by COVID, but we'll be back. Dr. Gavin Pape, a former chief and a good friend of mine, former chief who passed away while giving care in the Scarborough Hospital Emergency Department where he was chief. We started a clinic in his honor and his name because he was a donor and a helper and a friend. We have dietitians, we have diabetic educators, we have physicians, we have a really good team. We have the Rebound Mental Health team, which cares for refugees and newcomers who find the traumas of their journey, the tortures, the sexual trafficking, the abuse too much. We work with the Canadian Centre for Victims of Torture. We have a social determinants of health clinic and social casework clinics that help with housing and connections to the other determinants of health, safety, mental health, as I mentioned, and health and social work for housing, etc., the things that make us healthy. The only time they need a doctor is when they get sick and they can't carry on. Other than that, they need all of these other aspects of a healthy life that we all take for granted or work hard to get, I guess. And so who do we treat? There are 1.6 million, and I mentioned Canada's dreamers. We hear that in the US all the time. We have probably 80 to 100,000 young people in Canada from our estimates that are dying to work. They are working. They want to build the Canada they came to. They often came as kids. It's the only country they know. When I say we just had to sadly see before the pandemic, one of them be deported. He was a 17-year-old kid, and he said, I'm a Leafs fan. And he's going back to a country he can't speak the language in. I think we're nuts. I think our governments are not prudential. I think they're not prudent. These are all policies that could be changed. Harper changed them in a bad direction, and I kind of miss Harper right now. I think he might have gotten us some vaccines. But anyways, I think that, we really need to change our social thinking to help our country to grow and prosper. with much of the youth that we have here from years of pent-up immigration and then subsequent non-approvals. But they just stay here because their parents don't want to go back to the hell they came from. So the kids grow up here. They find out when they go and try to get a job or get a driver's license that they're not Canadian like their friends. They don't have a social insurance number, so they can't work. They work under the table. We probably have 1.6 million is the estimate if you combine refugees, immigrants, migrants, undocumented, in healthcare and status limbo in Canada. Slow processes at IRB, Immigration Refugee Board, contribute to that. Failed claimants who appeal become undocumented, people overstaying visas. It's just like in the US, and yet the US talks about it and we seem not to. And if you look at the undocumented workers in the pandemic, and I'll come to that in a minute, I'll try to speed up here, because I think you'll want to hear about the vaccines, the work we're doing with the vaccination pop-up clinic. They have no protections. They have no CERB, they have no UI, they have no sick days. Their jobs are going away just like everybody else's. And guess what they do? They go out and find any jobs they can, often working to be able to put a roof over their head and make their Canadian journey. And many of them, 60% at least, will become Canadian, unhealthier. And they do our triple D work, difficult, dangerous, and dirty. I'll skip over our partners. I'm just bragging that we have a lot of partners here, and we have a lot of helpful partners who help guide us. There's so much I could say about this slide. It's just one of the most, like when we started this, we started out in that church basement that you saw up there with Aisha. And we now have this center, and it's all because of the abundance. And I was going to say that. I mean, they've taught us about the abundance. They've taught us that if what we're doing is authentic to solve a problem that's major in our society, you'll get all of these volunteers and you won't live in scarcity. You'll never say, oh, I don't have enough resources to get this done. You'll never get this to fly. They come and we need to change the way we look at healthcare. We need, in my view, to make it inclusive of our society at large. It's a shared responsibility. Our corporations need to come to the table. They benefit. We all benefit from a healthy community. All of us coming together, if doctors and hospitals would really allow our community to pull in and help problems like this, it would be a lot less expensive, a lot less debt, and we get a lot better results, and we get a lot more done. Those were some of our impacts. Just know that we make lots of impacts for people. We did the Syrian Refugee Clinic. We did the Centennial College Refugee Clinic. We've had 50,000 clinic visits for patient care, probably more. We do the dental work, keep them out of the hospital. But anyways, I want to talk to you about COVID at the bottom. Try to get through this. That was last Saturday's COVID vaccine clinic at our center. Our center is just to the left on that picture. That's the Knox Church on the right. The big tall guy is over there on the left coming through is Global Medic. I heard you guys talking about Global Medic. We're an item, Global Medic and us. There they are setting up our tent. That field tent was in the Bahamas. It's heading off to probably Iraq or Afghanistan, Raul told me the other day. And Raul Singh, who's their director, and I are good friends, and I'm proud to say that, happy to say that. They're such a fine group of human beings. They're unbelievable. He's been talking about what's going on in St. Vincent, what they're taking down there. They bring that to us because we have a virtual refugee camp in Scarborough. We have seen 300 Asian women so far for the vaccines that are in the sex trade industry, some of them being exploited, some of them doing it because they can't take any other job and they don't want to be deported, and they're supporting themselves. We've done 4,000 vaccines roughly in the past 6 weeks in shelters. We go to the shelters. We have a mobile clinic. We have a pop-up clinic. There's Global Medic again, putting up another tent for us. We've been giving care in that tent during COVID because in outdoor situations, you don't catch COVID much. So that's a ventilated tent with a divider down the middle now. and the doc on nurse practitioner on one side, the patient on the other, plexiglass all the way down it, and an airflow down either side. That's where we've been treating patients. All of this has been created by donations from people like Global Medic and some of the patrons who support our work. There's our street clinic on the left. That gentleman came in our van. We went and picked him up. He's 78. He's had a major stroke. He's from Bangladesh. His family brought him over because he can't care for himself. And he is has the interim federal health program, so can't get care all the time. And our clinic has we've asked the government, we were on the provincial task force for vaccines, to drop the OHIP requirement for a card or an identity, because the undocumented will not come, because they fear that if they're identified, they will get a deportation notice. And they're not that far off, because that does happen. When they're picked up by the police, if there's a car accident, they run their name through a computer. Before they're taken, if they don't have to go to the hospital, they're taken to a detention center. That is happening all the time in this country. And that's why we've actually been given the go-ahead to start up, because we're probably the only clinic right now that is doing these no need for a health card, because these frontline workers are undocumented workers doing the type of work they're doing. They are if they have to come and prove their ID, have a no-hip card, which they don't have one, give a driver's license with their picture, they have a reason to fear that it might be identified one day. So that's the shelters. On the street there was last week at Markham Road in Eglinton. Global Medic came, we put up a tent, we vaccinated 75 homeless men and women at Father Ubertino's St. John's Mission, where they get food. We don't let the kids languish in the waiting room. I'll go through these in 1 minute. That's a teacher there who comes into our waiting room to teach the children English. And that's a Syrian refugee. That's her sponsor. That's his sponsor. And over is his mom to the other side. They were part of our Syrian refugee clinic. And what you'll notice is they have a smile on their face. So that's important. That's what Canada does. This was a Nigerian woman who left the U.S. because she was there and she was going through harassment in the society because of what Trump had done. Immigrants weren't welcome in Trump land. And she crossed at the Erie border, and she had purchased a trip in a truck and came across in the back of the truck. I called it our frozen Mediterranean. We saw hundreds coming across from the U.S. Yes, they were crossing at the Quebec border, but they were crossing at Erie in the back of trucks by the thousands. And she was let out of the truck in the middle of winter. It was a very cold winter that year in 2018, and her hands froze. And my wife looked at that picture and she said, "Oh my God." I said, "What?" She had nail polish on. And it's because she didn't want, and I asked her about it later. She said, "I don't want people to think I'm a bum, that I'm just a refugee. I want people to know that I can look like this." This is another person whose hands were frozen. She lost 2 of those fingers. We gave her care. We gave all of these folks care. This is our clinic right now. It's the hallway down the clinic. That's on a easy night. And this is a little girl we saw in the West End because we were asked to go out and take care of the shelters out there back during the influx from the US. We saw so many from the US, those frozen hands. So many stories I could tell you, but there's no time. There's a lot of us. I'm the luckiest guy in the world, I'm noticing. I'm the only guy there. I just noticed that. Oh my gosh. And I'm younger. I'm just as bald. Takeaways. You know, I want to say this and then I'll stop. I didn't finish this slide because I was just doing these slides this morning, throwing them together, had a bit of a break from vaccines. You know, Unfortunately, health access inequity and resulting health disparities is alive and well in Scarborough. And somebody said this to me. I didn't say this, but somebody who said this to me is an ICU doc at the Scarborough Hospital right now. I have great admiration for Howard, what he's doing right now. It's heartbreaking, really, to think about what's going on in our ICUs right now. And we just had 10,000 vaccines canceled this morning at the Scarborough Hospital. I'm just going to say that no one, what Howard said, no one at the corner of Markham Road in Eglinton receives the same level of care as someone at Yonge in Eglinton. And he's absolutely right. Scarborough is being, Scarborough's the hottest spot for COVID right now with 25 cases. A 25% positivity rate, and we got our vaccinations canceled. We have received no increase in vaccinations from the Ford government. But of course, Etobicoke did. That's where he's from, and that's where his nephew is an MP. And if you look at the postal codes, you will find, and I hope the press tears into this, you will find that he put on the list, he put postal codes for the hot spot lists that are not supposed to be there, and guess where they are, and others that are supposed to be there because they have the highest rates of infection are not on it. And if you look at who's received the most number of vaccines in Toronto, it's right up and down in the Beltway, between Bathurst and for the 400 and Keele and the Don Valley Parkway and the 401. That center swath has the lowest infection rate of COVID in the GTA and has received the most vaccines. Etobicoke and Scarborough, the other side, the U of poverty around that beltway, who have the highest rates of COVID, have received the lowest number of vaccines. So one of my takeaway messages is we need to pull together and advocate for Scarborough, because Scarborough's been too complacent and the politicians have not stepped up. I'll stop there. And I'm sorry, I probably went over time, but it's really a pleasure to be able to share all of this with you. And thank you very much.
Paul, can you unshare your screen, please?
I bet you I can. Stop sharing.
That's it. Thank you.
Fitting as an expert, Paul. Very good.
Oh, what a.
Anybody got any questions for Dr. Paul?
Oh, so many.
If I can jump in a bit.
Yes, Courtney, go ahead.
Paul, can you just square a few things for me? When we use the term sanctuary city, what does that mean with regard to resources for the clientele that you serve?
So, great question. Thank you. Sanctuary city does not include access to the healthcare at a hospital or at a family doctor's office or at a clinic like these. Sanctuary city instead brings other wonderful determinants of health resources to the persons who are undocumented, who don't have status issues. So for example, libraries. Used library, no card needed. The card is identifying card is a dangerous thing for those of people who are undocumented. Use of swimming pools, public facilities, no questions asked. That's sanctuary city. And some medical care in a way of getting to a public health clinic. So Toronto Public Health operates some clinics for, I think, ST, sexually transmitted disease screening, birth control. We operate one as well. I think, and some vaccinations, but they're hard. And some, vaccinations. Undocumented won't go there often because they're worried that they're being observed. We had a police car drive accidentally, I'm sure, and nothing's mentioned. Global Medic took care of this, by the way. They just simply called up the chief of police and said, don't do that. That's what Royal does. And when that police car drove by that line you saw in the lineup for the vaccines, where the tent was, people ran. people ran from the line and I don't think some of them got vaccinated because they were certain that the police were going to identify them. And we live in Scarborough in a very racialized community. I mean, I can say that as a guy who's not racialized, and I can't believe that that Scarborough has been treated the way it has been, and it's easy to do. That's what I think. It's systemic, and it's not a good situation. But that's what sanctuary city basically means. But it doesn't cover this vaccine or the services that we give for healthcare.
Paul,
Question.
oh, sorry. Go ahead, Mike.
Okay. I'd like to thank you for your presentation, Paul. It's excellent. You clearly pointed out the problems in Canada of all levels of government not meeting the current situation. It looks like it's been for quite some time. Could you give us some examples of other countries or jurisdictions that are doing a better job, or that Canada could look towards for enlightenment? Thanks.
I think what this talk says in terms of comparators to Western industrialized nations with public health systems, and we just did a review on this, is that we're all in this boat together of making this mistake. There are definitely some countries that do a better job, in particular Germany right now, and in particular, I think that the Scandinavian countries are doing a better-ish job, but nobody's doing it the way it should be done to create some degree of health access equity. And there's a lot of health disparities and bad outcomes as a result. Ironic to say, and then the last thing I'll say is that I believe that, and this is my belief, I don't know I have the proof, that the United States is doing a better job. Their Medicare program does not turn people away at the emergency department the way we do. And our emergencies are turning people away left, right, and center based on arbitrary decisions about what's an emergency or not. There is no standard decision of that, no standard guideline for that. And when patients who came from the United States, that was a huge number that came, almost 55,000 in 2018 after Trump disturbed the atmosphere. We saw them, they were never planning to come. They're undocumented there. Their lawyers were saying to them, you will never, ever get in here. We can't get you in now. You're going to be deported. And they would be in pregnancy clinics. They would be in obstetrical clinics. They would be receiving care through Medicare. That's how they were going to be found out, however, because ICE, their agents, were going through medical records. But they were getting care until Trump turned the tables over.
Well, I've heard we've had people who visited our club before talking about Scarborough, and part of the problem that we face in Scarborough is that our resources are not being properly, or the resources aren't being allocated according to proper population demographics. Mm-hmm. I've heard that we have something like 500,000 people who are living mainly to the southern areas, who are couch surfing and or in multiple family homes and this sort of thing, and they're just not getting access because we don't have the access available. What are your thoughts on that? And I guess you serve a lot of those people too, right?
Yeah, we do. It's another great question. The situation in Scarborough, I can give you some basic facts and anecdotes, at least empirical information. 70,000 residents. I saw this statistic the other day when we were looking at what our hotspot and our mobile outreach to shelters would be like in Scarborough at the Scarborough table, vaccine table, and 70,000, it was presented, residents live in Toronto's public housing for people of low income housing. 50% of that is in Scarborough. 50% of those buildings and people are in Scarborough. And we're not receiving 50% of the vaccines for them for that age group, not near. So the resources are not matching. That's one example of a problem. The 95% of our patients are persons of color, are from visible minorities, are from racialized populations, 95%. And 90% are in exactly the situation you said just now. I think David had said it, right, David?
Yes.
Yeah, thank you, David. That they are meeting the homeless and or precariously unstably housed definitions because they're couch surfing, they're in rooming houses, they're in shelters, they're in various unstable housing. I think that the number you quoted is interesting. If you look at the number in Scarborough's population, it's 670-ish thousand right now. So 500,000 would be extraordinarily high for people being in unstable or homeless situations or couch surfing situations. I would guess, David, it's more, and I apologize, this is truly a rough guesstimate. I am guesstimating it will be about 150 to 200,000 people have a very unstable housing situation or an overcrowded housing situation. We know that the vast majority of COVID cases and why Scarborough is so high is because of the congregate housing and because of mistrust of the medical system by the Black population. We are seeing an incredible mistrust, and it's not vaccine hesitancy, it's vaccine mistrust. And the reasons that are told to me are quite stunning, quite frankly, and it's not my lived experience, but these types of housing problems have come home to roost during this pandemic in Scarborough and Etobicoke. And it's, if we don't change our ways, if we don't create equity in these communities, work with these communities to do that, the next pandemic will just bowl us over, and there will be another one. And this one's virtually bowling us over right now. We're in big problem right now in this. I'm not sure how we're going to get out of this, to be quite frank with you. I mean, if we had to cancel 10,000 vaccines today, and that means our Saturday clinic will be canceled for 400 undocumented workers and others in Scarborough who are in chronic diseases, age 50, people in the hot spots, essential workers. And I don't want to get too political, but how are we going to get out of this if we can't vaccinate people?
Okay, Paul, thank you very much. It's 20 past 1, so I think we better kind of wrap this up. Courtney, can you thank Dr. Paul, please?
Sure. Where do I start? That was really just very instructive, very informative. Paul, you provided us with information that I'll speak for myself, but I think it applies to others that we just did not have. You know, you gave us a sense for a depth of the problem, the magnitude of the problem, and you brought the point home, I think, when you began to touch on the politics of it, because unless there is significant policy changes, you know, that you started to hint at, and that I know someone like John Stapleton has referenced in the past, you know, unless we really get to those things, we will forever be throwing money at charities rather than systemic change. So I want to really thank you for bringing data to what we perceive and for giving us a really great sense of the problems that currently exist and that will probably exist in some time to come. Thank you very much.
Thank you, Paul. Okay, now, Paul, as I said to you, you're welcome to, for want of a better expression, hang around. We have some sort of Rotary stuff to do, but you're obviously very busy. So if you have to go, please feel free.
Thank you. Don't think me rude, but I'm going to let you guys get on with your work, and I'll move on to mine. And I'll just say that it's been a great privilege to be able to chat with you. I think the more we transfer knowledge, the sooner we'll get to where Courtney said. Take care, you guys. Really.
Okay. Thanks again.
Stay well. Oh, listen, by the way, quickly. If you know folks who are in the circumstances that we've been talking about and need and deserve and qualify for the vaccine, but may not feel comfortable or able to go to a pop-up clinic, to a mass site, you know where our address is, and there's a phone number on our website. They can call in to help book a vaccine and try to book a vaccine, okay? Yeah, that's good. Thank you, guys.
Thank you.
Bye.
Bye-bye.